Hi everyone, this is Neil Writer, also known as the Wax Whisperer. Thank you for joining me in my latest video. This patient is actually a family member. It's my aunt, and she's given me permission to upload this. I have encapsulated 3 separate visits. So unfortunately my auntie is suffering from an ear infection, more specifically otitis media with effusion. So otitis media means a middle ear infection, and effusion is fluid. So she's got an infected middle ear cavity and there's fluid buildup in there. In addition to that, you can see that she's got this lump of really dry wax keratin at the entrance of the ear canal. She's got a very, very narrow lateral aspect of the ear canal. So when we say lateral, we mean near the entrance. And I'm just using an ear hook to try and prise this away. It's a bit unusual because my auntie doesn't actually usually suffer from earwax or dead skin buildup. So at this stage I was unaware that her ear was infected. But in a minute you're going to see that my auntie actually has a grommet as well. I'm going to explain what a grommet is and how this infection occurred in more detail during the course of the video. So this is her first appointment. She visited me a couple of weeks ago, and now you can see we removed all the debris, all the wax, all the keratin. That's occluding the ear anyway. And that in the distance is her eardrum. This is her left ear. And there is a puddle of purulent discharge, so outer ear or middle ear infusion. It's got many different names, but this discharge is originating from behind the eardrum in the middle ear, as opposed to the ear canal itself. If this discharge was originating in the ear canal itself, we will call that otitis externa, an outer ear infection. And that white object there, that is a grommet. I believe in America it's called a ventilation tube or drainage tube. And so why do we have grommets? What are they, and how do we develop a middle ear infection? So let me try and explain. Now, the middle ear is the cavity behind the eardrum, and it should be air-filled, and the air pressure behind the eardrum should be the same or near to the air pressure in the atmosphere, so the air pressure that's in the ear canal. When the air pressure is equal either side of the eardrum, that's when we hear the best. That's when the eardrum is most mobile. So what equalizes the air pressure? And I'll come back to that in a moment. So this is appointment 2. So after appointment 1, I referred my auntie to her GP for some prescribed medication. And I recommended, actually, and again, we can't tell GPs what to do, so that's going to be very clear. So as an audiologist, I'm not a medic in the UK. And we're not allowed to prescribe medications ourselves. But I did give a suggestion because I have worked with a number of patients with middle ear infections, with grommets, and I've worked closely with ENT before. So knowing what my colleague, Mr. Vajali, who's an ENT consultant, would recommend, I made the suggestion in my referral letter that it would be ideal for my auntie to be prescribed topical ciprofloxacin. So ciprofloxacin was originally an eye drop, so antibiotic eye drop, and it's been used by ENT surgeons off-label also for ear infections. And one of the reasons for that is ciprofloxacin is what we call non-ototoxic. Believe it or not, many of the medications we use for ear infections are ototoxic, and